Are you guys against home birth altogether?
Me, I'd say yes. I'm going to be honest. I can never see advocating, not in this country. Sorry. Like if we're talking about in England with a home birth certified, like their version of certified nurse midwife who works in tandem with a doctor at a hospital and also works there, and they're a low risk mother, then I would be supportive of that. But in this country, absolutely not. There's nothing like that here. There's no state where it's like that. There's no hospital that has affiliations with home birth midwives. There is nothing, no safety net like that. So I cannot support home birth here. Like I could not say, yes, that's a great idea.
I think for me, that's a really loaded question because I have been present at many successful low risk home births. I've attended them as a midwifery student. One of my good friends comes to mind that she just slips her babies out. Like for her, birth is not a problem. But that said, that could, like every birth is different, right, Liz? Every birth is different. That's not to say that the next time she has a baby that something bad isn't going to happen. So
right. My first 3 just slipped out. I had successful home births, and then my 4th didn't. So
it's a really loaded question for me because I have been present at many successful home births, but I've also experienced the tragic side and have seen the tragic side come into my hospital. So, when people ask me that question, I say you have to be fully informed and you have to understand the risk. And is that a choice that is your infant dying or being harmed, a choice you're willing to make for that decision? It's a hard one for me because, like I said, would I want my daughter to have a home birth? Hell no, no way, no how. But for somebody else, that's part of I don't know. It's a tough one.
For me, there's also this huge emotional, I want to say that maybe it's selfish, but like my sister-in-law's big home birthy. And I had to like unfriend her on Facebook because I couldn't stand it because it made me feel like I'm going to puke whenever I see the post. And I'm a horrible person because it's not just that I'm like worried about her, because I am, but there's also this like when afterwards the like smug, happy, proud of herself stuff that makes me mad because I'm like, you're just lucky. You think you're special. You think you're better. You think you're healthier. You think you did so much better than me, even though you're not directly comparing, but that's what it is. Like I conquered this. I won birth. I did it right by my skill, by my provider's skill. And the truth is you were lucky because you dodged a bullet. And so there's these two warring feelings and they're both bad. One is like worry over, somebody close to me having a home birth. And then B, when everything doesn't go well, I'm glad the baby's healthy, but that smug, like attitude of, and then they say things like, you're a downer with your stories, or I don't want to hear this. And it's just like, you don't know how close you skirted to that. You have no idea because you're just lucky. That's it. You're just lucky.
Yeah. And it goes back to gaslighting of her providers, right? Telling her, oh, this is how it always is. It's perfect. And us here sitting here in this Zoom meeting, we know it's not perfect, right? But that doesn't get out there.
No.
Yeah. Well, I said on a post this week, I said, the dominant narrative for if something bad happens at a hospital birth, it's the hospital's fault. You're the victim. I don't agree with that. But the hospital's responsible for something going bad happening during your birth. Now, if something goes bad during your birth at home, it's your fault.
Because you didn't listen to your intuition, Mama.
Because it's not your provider's fault, which is kind of like, well, wait a second. If we're going to be consistent, it's always the provider's fault, or it's always person's fault. If we're not consistent, I mean, I know the reasons why, but that's one of the reasons I'm against the home birth culture. Strictly speaking, if you follow the protocol that the Netherlands and some other countries do, which is really strict and rules out basically 80% of the geographical United States. You have to have a qualified provider. They have to be working with a hospital. You have to be close to an appropriate transfer hospital. You have to be low risk, absolutely 100% low risk. You can't have any risk factors that should put you in a hospital and said, then it's like, okay, go ahead, have a home birth, because you have the safety net in place. You have the well-integrated provider. You have a responsible provider. Everything is as good as it can get. And that describes maybe, I don't know, a couple handful of unicorn midwives in the United States, and the rest of them, I wouldn't have them watch my cat give birth.
I think the question is a hard one because I don't ever want to tell somebody what to do with how to make their choices of what they want to do for their pregnancy, their birth, their kids. It's your choice. But I do think people should be fully informed. And that's not just saying, listen to what the natural birth tells you and then ignore the stories of loss and injury and trauma and all the horror stories, because that's not actually being informed. You actually have to look at both sides. And a big thing that we recently were talking about is learning about C-sections. A lot of us don't actually look into C-sections. We are scared of C-sections, but we don't ever actually look into them. We don't actually have any knowledge about them. So I would say that's part of being informed. I think we should all, when you're pregnant, hear about both sides, not just how vaginal births are, but I think we should really be hearing about, C-sections too. You need to be aware, because guess what? It could happen. When I don't even say, oh, you're having a vaginal birth anymore. I actually say, when I'm writing to people now and I'm having conversations, I actually say, so you're trying for a vaginal birth. Because unfortunately, from what I've seen and what I know in my own experience is, you may try for a vaginal birth and you may want it to the moon and back, but that doesn't mean that that's what's going to happen to you, because things just happen. And it might not be you. It might just be something else that's going on. Your baby needs to get out sooner than it is for, you going through labor. You know what I mean? Like maybe you could labor days, months on end, and it's not a big deal, but that's not the same for your baby. So I think that's kind of the thing, is that I don't want to tell anyone what to do, but at the same time, my feelings about home birth are, don't do it. Don't have a home birth, because it's not worth the risk. You may come out alive, but what are you going to do to your kid? Is your kid worth the risk to be at home? Because something that we don't think about is, we've been told by our midwives, don't worry, the hospital's right down the road. I'll transfer you right away if there's any problems. Guess what? Get in the car. 5 minutes away, you get to the hospital. Even if you went through the ER room and then they're getting you up to where you got to go to the labor and delivery, well, now you're at 8 minutes. Then you got to get to an OR, to get your kid out. Well, now we're at 10 minutes. There's a doctor, there's a team scrubbing up. Everything takes time. They were not prepared for you. They did not know who you were. They don't know about your baby. They don't know anything. So all that is time. And I personally don't think that time is worth the risk of what your baby is literally in there. My kid suffocated. So hold your breath for 10 minutes. Hold your breath for 5 minutes. Try 2 minutes if you want to. We don't even have to do the full extent, but there ain't no way in hell you're getting from your house to an operating table with your kid out in 2 minutes. Now imagine 10, 15, 20 minutes. Unfortunately, that's what I think we don't talk about. What we don't think about is the transfer side of getting from a birth center or a home birth to the hospital, where the medical team is there and available, ready to do their thing. They know what to do. They know exactly how to save your kid. But the problem is, and maybe even you, they might even be able to save you with transfusions and all these things. But unfortunately, you're not at the proper place of where you need to be to get that care. Care isn't immediate the moment that you get there. If you are 5 minutes from the hospital, you are not getting care in 5 minutes, because you still have to go up. My hospitals here are levels big. I'm assuming everybody's hospitals are big like mine. Okay. You got to get on an elevator and go up to the proper floor to get to the maternity wing. You got to go down the thing to get to the OR. This is all time, and they have to assess you too. You can't come in and your midwife say, she needs a C-section. That's great. We have to like
Right.
check her.
They don't know
What's
who
her
she
blood
is.
pressure? Yeah,
Who
exactly.
are
We
you,
got to check
lady?
blood
Like,
pressure.
what
We
are
got
you
to check
telling us?
baby. Who are you? Random stranger off the street. Like, that's what I mean. They have to assess you. So even though my midwife had called ahead, we were going to the hospital. The doctor was waiting for us. The team was waiting for us. They were ready. They knew baby is in distress. I'm assuming that's what she said, is that baby was in distress. I don't know. Maybe that's not what she said. I don't know. But they knew we were coming. When we got there, they had a wheelchair waiting for me when I got to the front. I got in the wheelchair. I had to go up the elevators. I had to go to the room, the assessment room. They don't take you to the OR. They take you to a separate assessment room with monitors. They put the monitor on you to check you and your baby. They're checking you out. They're checking your baby out. Hey, oh, C-section. Now you go to the OR. That's more time. That's not against the hospital. That's protocol. They have to know what is happening to you and your baby to give you the proper care. They can't just start slicing and dicing. You know what I mean? Like,
How much
they have to
time
do
was
what they got to
your-
do.
How much time was it from you when you decided to transfer until you were at the place where they could cut? Like, how long was that for you?
Oh gosh. Well, I would say
It
my
wasn't 5
guesstimate
minutes, I'm
time.
guessing.
Oh, hell no. No.
Yeah.
I want to say my guesstimate time from when we found out his heart rate had dropped. She had made her phone call, did whatever the hell she was doing, because she disappeared for a minute and I don't even know what was going on there. By the time I think she made other phone calls before she called him. And then they were like, call the doctor. We passed.
She's on Facebook.
Oh, no, that was the day before.
Oh,
That was
okay.
the day before. She got on Facebook the day before. She was making phone calls to other midwives here. But we passed two hospitals. One of them was literally around the block. Another one, we drove down a road and we would have went up a couple of blocks. There was a hospital. We passed two hospitals to go to the hospital because it's midwife friendly and she had called ahead. So all that time, if we had gone to the one around the block, probably would have saved his life. If we had gone to the one that's literally a couple of blocks, they're really close. If you would have went right here and just went over, it was like a 5 minutes probably span. I've looked at it in the future. Like, I couldn't look at it, but recently when we were doing the videos and stuff, I looked at where we were and where the hospitals are around us. Literally, the one was around the block. The other one was 5 minutes away. So there's your 5-minute hospital was right there. We drove by it. So I'm guessing we got stuck in traffic. I'm guessing that easy 15 minutes. 15 minutes is what I'm going to say. When we pulled up, they had already known we were there. So they were waiting for me with a wheelchair. I got up, whatever. I would say elevator ride going up, that's another minute, easy, maybe 2 minutes, depending, like, you're pushing, get up, whatever, you go in there, you go in the room. I will say they were really fast in the room. The monitor was going on me right away, but the first thing they have to ask you is your name, your date of birth, and can they treat you? You have to approve them giving you care. So I do remember them being like, are you okay with us giving you medical treatment, taking care of you? You're our patient now. And I was like, yes. So I had to tell them yes. And then that's when monitor went on. And then before he could hardly finish a sentence of even meeting my midwife, he was like, we got to get the baby out right now. And so that's what it was. So we went to the other room, and how I know it was so bad. And here's this 15 minutes. My kid was still alive, heartbeat still there. I would say at this point we're at, I'm going to say 20 minutes. Let's be fair. It's probably 20 minutes when we got to the OR. And when we were doing all this, the nurses were stripping me off before we got to the OR to do a C-section. He was already there, and all this stuff or whatever. People say there's no way they weren't going to put you under in general. There's no way they weren't going to give you anything. They were not. And I know from talking to other mothers that have ended up in emergency situations, sometimes they do not. They do not give you that. So I want people to know you're not always going to get pain relief. If it is that emergent of getting your child out, they are going to do what they are trying to do to save your kid's life. And you are going to go through whatever. And I remember, because I went through shock. Like, I ended up going in shock, and that's how they gave me any pain relief. And, but again, my kid came out alive, and they were just trying to save his life. They had a heartbeat. They knew he was there. So they were just trying to get him out, and they did the best they could. But It's just not enough time. It's not enough time. My kid came out alive and it's not enough time. And so in my opinion, even if it was 5 minutes sooner, would have been the 5 minutes that the nurses had needed? Was it the 5 minutes that they needed to get out? I don't know. We really don't know. And I've heard from people about the reserves, baby reserves. But the thing is, any medical person will tell you, we don't know what the reserves actually are for anyone. Is that a minute? Is that 30 seconds? We don't actually know. So the reserves of that is it's a load of crap.
So I'm going to explain that a little bit. Now, our lungs, we inhale, we absorb oxygen. More importantly, we release carbon dioxide. During hypoxia, not only are we not getting enough oxygen in, we aren't getting rid of enough carbon dioxide. When they check the pH of your baby's blood, cord blood frequently, they're checking to see if your baby is in acidosis. CO2 is acidic. And the higher concentration of CO2 in your baby's blood is a measure of how long they've been deprived of oxygen. So it's kind of like a time metric. It's like there's a difference between holding your breath for a minute, 2 minutes, 10 minutes, and babies do have quote unquote reserves because their fetal hemoglobin is much better at scavenging oxygen. But if it's not coming in, their CO2 is just building up and building up and building up. And those reserves mean nothing once CO2 gets to a certain point. That's it. You need that.
Yeah.
You need that oxygen.
He had a heart rate, but what was that heart rate, right? Was that 60 beats a minute? Was it 50 beats a minute? Was it 40 beats a minute? What's a normal fetal heart rate? 120 to 180. So, it's completely tragic and sad. So,
And another thing is with midwives, how long ago, I can ask this question, how long before my son went into distress that he was actually in distress? We'll never know, because it's not like they're checking. You're not getting continuous monitoring like you would at the hospital. They know exactly when things drop. They know exactly when things change. But midwives aren't checking that. So this just happened randomly, and she was still sending us home. So it was just a random check, and it was less than 100 at that point. It was I think it was maybe 90 something. And so it was how long had it been under 100? How long had it dropped from his normal thing? We will never know. And so even if there was reserves, the reserves could have already been getting used.
So
right
Danielle, if we had, okay, if your home birth had been the gold standard home birth, well integrated midwife, hospital close by, you had that. I forget, 1, 2, 3, 4, and one of them is low risk. At which point, how long before you actually gave birth should you have been risked out as a low risk person? A week, 2 weeks?
Yeah, I was at 42 in 2 days. So I was
at least a week.
I was over a week. It was over a week. By the time I hit 41, and I'm still not having active labor, I was having spontaneous labor is what she called it. It was at that point, if there's labor, but it's not staying consistent, why didn't you just send me in? It hurts no one to be the best friend that goes and holds the hand in the hospital to induce, or to see why this is not staying consistent. I don't understand why midwives see the stuff and then are like, we're going to do it at home anyways. Let's challenge the system of your body. No, just that would have been, and I've always thought about that too. She could have saved the day. And even if she wanted to push the limits and did like she did when I went in the day before and there was no fluid, but he was completely fine, why didn't you just send me in? It's not hard for someone to say, I don't have the answer for you. Let's go see a doctor that has the answer. You can go to a doctor, an OB, and have a question and they can't answer it. And they say, you know what? I'm going to send you to a specialist. I'm going to send you to another doctor that will have the answer. But why is it so hard for a midwife to admit, I don't have the answer, so I'm going to send you to somebody so you get the proper care. That's the thing. Why are we hiring a midwife to give us care, but you're not getting the proper care? Like, just risk us out. Just do what we need to do for ourselves and our babies. So there's my biggest thing about it. And then with home birth and all this stuff. But you know what? I can't even say anything. I'm not one for birth centers either. So there was my stance on home birth. Don't have a home birth. Don't go to a birth center either. If your birth center is not attached to a hospital with doctors running it and nurse midwives and nurses that are labor and delivery team with the NICU team and all that stuff there, you're at the same damn thing as what I just had. If you are at a birth center that is not like affiliated, attached, and part of the hospital community, like it's not part of them with medical people working them, you are at a glorified home birth. That is all you are. You're at a boutique. There's no difference from what I had. Even if a nurse midwife is there, it is the same thing. I thought I had a nurse midwife. Many other people have nurse midwives for their home births and still lose a baby, still get injured, and bad things still happen. So I am like, nope. And we also found out about accredited recently. We were saying, go to an accredited one. We were thinking maybe there's a gold standard somewhere with birth centers. No, that is a load of crap. And we found out that some baby killer midwives own accredited birth centers. So we cannot say that. And I will never say that. And I do not back them. If there's not a doctor, an OB gynecologist running it that gets to look at all the charts to make sure that people are low risk, how you're supposed to be with an out of hospital setting, sorry, like it's all the same. And we know in the past couple of years, yes, there's been COVID going on, but there's also been a bunch of studies happening between the UK and the United States with our favorite doctor. And he has been working with other countries where we're looking at the differences between who's attending the births, out of hospital birth, in hospital births. He does all the statistics, does all the numbers, and he actually will say it doesn't matter if you have a doctor at home. Like if you have somebody at home, like unless they can perform a C-section, like sure, they're going to perform. No doctor's going to perform a C-section in your house, or at least I would hope not, because that's kind of gross. But anyways, it's not a sterile environment. But the reality is out of hospital is just more dangerous than in hospital. Period. And that's what we're learning. Like that's what the studies have shown. It doesn't matter. You can have the best provider with the best intentions, with all the knowledge in the world. But when things go wrong, there's not enough time to get you to where you need to be. Yeah. So there's my thing about that. Unfortunately, like I would love to have some type of support about that, but it's too risky in my opinion. It's too risky. And living with what I know, I don't wish that on anyone. I don't wish that for anyone. So I can't tell anybody like it's your choice, but at the same time, please listen to other people that have lost, because you don't ever want to end up in our shoes, because it's terrible. Like it's horrible.
And I think the birth center gives a false sense of security,
Yes.
because it's like a birth center. It's like a home that's like a hospital, or it's not. It's not. Even if that birth center is directly across the street from the hospital, like you get a prolapse cord, you're not going to get a C-section fast enough. Like it's not going to happen.
Are birth centers any better than a home birth?
I think we just answered that. No.
And there it is. Yeah. Like that's an easy one.
It's just, you don't have to keep your house is clean.
Exactly. There's not blood everywhere.